Okay, well, I know we're starting a little bit late. We had some technical difficulties on the front end. So maybe what we'll do is go ahead and get started, and there might be some others who join us along the way, and that is okay. We can just bring people in and get them caught up. But in the interest of using our time, welcome. Thanks for joining us. I'm Shauna Revkin. I'm with the Workforce Development and Planning team at Seattle Children's. And we are delighted that you are able to join us today. You may be familiar with Seattle Children's Hospital or our clinics, but you may not know that we also have a very large research institute where we are working to develop and test new treatments and therapies and to better understand health outcomes and the very best approaches to care. And we have two fabulous folks here today from our research institute to share a bit about research jobs and their own pathways. So I want to introduce Michelle Scalland. Michelle, can you wave so people see? There she is. And Katie Davis. Well, we will, before we get started, just a couple of housekeeping items. One is that in healthcare and in research, we always start presentations with a disclosure, which just means that if there was any reason that any of us had an opportunity to benefit financially from being here today, we would just need to tell you that, and none of us do. So that's easy. Those are our disclosures. And then just a quick, before you hear from Katie and Michelle, just a quick overview of how we'll spend our time together. We'll start with a quick check-in, and then you'll hear from Michelle a bit about her pathway, and then the same from Katie, and then a bit more about research jobs generally. And then if we have time, we'll share some opportunities that you may want to check out if you want to learn more. But most importantly, we really want to hear your questions. So we've reserved some time for Q&A at the end, but please feel free to put your questions in the chat as we go. If something pops up, or if there's something you don't understand and you want clarification, raise your hand or put that in the chat, and we'll make sure to answer as many questions as we can. So thanks again for being here today. And I will hand it over to Katie.
Hi, as Shauna mentioned, my name is Katie Davis. I use she, her pronouns. And when I was preparing for this talk, or Michelle and I were, we decided to check in with my kids to see what they recommend for, that their teachers have done that they found effective. And they agreed that having a check-in before jumping into material is always helpful. Next slide. My daughter, who is a sixth grader, said that she likes scales, and sometimes they have baby donkeys or all kinds of things. And when she mentioned Baby Yoda, I was like, that's what I want to go with. So we have a scale of Baby Yoda as one possible way to share how you're feeling today. The pictures, if any of them resonate, you can type it into the chat, the number. Other ways, if you're not feeling Baby Yoda today, then just sharing something about how you're feeling in words, or you can even at this time unmute yourself or use the emoji reactions to let us know where you are currently. And I can share first to kick us off that I would say on a Baby Yoda scale, I'm around number 9. I'm curious and maybe feeling a little bit shy to start off, but I'm really interested in how everybody's doing. It looks like Michelle said that she's a number 4, feeling sleepy, tired. Wahida said a combination of 3, 5, and 9. So, wow, surprised maybe. I don't know. I'm not quite sure what 3 is expressing. 5 looks kind of content, and 9 also kind of curious. Shauna is also 9. This is great. Baby Yoda number 8, open to what's ahead and curious by Wendy. And Vicky 7 and 9. I love the 7 enthusiasm. That's great. Sarah 4, 7, and 1. So yes, sleep, also feeling tired relating to Michelle. So thank you guys so much. Is there anyone who hasn't shared who'd like to share? And you're also welcome to use emoji reactions or unmute, or really just to abstain is also an option. So I'll give it a second to give you what you think about possibly sharing. There's no wrong answers here. All right. I think we're okay to advance. So thank you guys. I'm excited to have participation, so I'm feeling a little less shy. And yeah, thanks. It's great to be here.
Thank you, Shauna and Katie, for kind of starting this off. I'm Michelle Scallon. My pronouns are she and her, and I will be one of the presenters. And I currently work as a biostatistician, which is a bit of a mouthful. And we'll get a little bit later into exactly what some of the work is that we do. But first, I wanted to briefly talk about a little bit of my journey. And so in the pictures, I like to kind of show the difference between who I was at 15 years old and then who I am now about 14 years later. And I use 14 years as a reference point because the picture on the left is me at 15 with my little sister, and you know, she was kind of like my baby. And now, almost 14 years later, she's feeling like she's grown up, but I have my own baby. And so I kind of like that picture to show how much time has elapsed and how much I've also grown within my career, but then also personal life. And then a little bit about my personal background. So I identify as a Honduran Mexican American, and I have multiracial ancestry. For those of you that are within the Hispanic or Latinx community, I'm sure many of you can join in with me in saying that many of us, either we don't quite know what our ancestry is, and it's kind of a mixture. And so that's something that I kind of like to remind folks. And I'm also fluent in Spanish, but it's more like Spanglish. So again, for those that maybe grew up in the US or families where you actually speak both English and Spanish, you'll kind of switch off. I also grew up with a household mostly of women. And my mom came undocumented in the 1980s. And so when we were growing up, we really needed financial assistance through some of these programs that I've listed. And then I also think about the fact that as I was growing up, I also had to deal with some toxic family relationships. And I also survived some childhood trauma. And because of that, and in addition to everything else that happened in my life, while I was in graduate school, I actually developed a autoimmune disease. And essentially what that caused was symptoms like depression. I gained a lot of weight, fogginess. At the time, I thought it was grad school. I'm sure some of you might be feeling that in school. It's like it could get overwhelming. I thought it was graduate school. It turns out it was something more, also physical. And I also developed skin writing. I don't know if anyone's heard about it, but essentially if I write, literally like just do a little scratch mark on my skin, it elevates. And so it's sometimes cool because I can kind of write my name with, just, and then fortunately it goes away. But that is something that I also developed. And again, it kind of goes to because of the stress that I had to deal with over the years. And so because of everything that I've experienced, I've had to regularly attend therapy sessions, and that helps me to deal with some of the healing that needs to be done because of my past, and to also help manage my anxiety and depression. And of course, all of that impacts how I show up at work. And I think it's important to remember that everything about you matters in terms of how you show up for work, and then what kind of perspectives you bring. And I've learned to appreciate my experience, even if it's bad or good. I've learned to appreciate all of it because it does impact, and it does give me a different lens to say Katie, who's had different experiences as well. And so quickly about some of my high school experiences. I loved math, not so much English and Spanish. So I also learned that part of it wasn't because I was necessarily a bad student, which I don't necessarily like to use the term good or bad. It's more of like, I wasn't interested in it, and that's okay. And that's something also that I think is important to remember, that you can, in school, however you do, that's not necessarily a reflection on your worth. It, I think, has to do more with how interested you are. And for me to be in research, it's important to be curious. And so some of that curiosity led me to Dunkin' Donuts. Turns out I do not want to work in the food industry, and that's okay. But that was an experience that I learned about. And I didn't have any conversations about my career with anyone, but I did follow a medical examiner. I got to see them perform an autopsy, and I was like, yes, this is it. I want to be a medical examiner. Turns out, no, because I did not like any of my science classes. So in undergrad, I decided to switch over to applied mathematics and statistics because that's something that I enjoyed and I excelled at. And this is kind of a brief little picture that highlights my trail. The gray ones where it kind of looks like a sad face, that's times when I've experienced mistreatment. The purple where you see like a little house, it's when I've moved. And so I did move across the countries at time, from California to Boston area to South Florida to over here. Yellow is like the nice things that have happened in my life. And of course, we can discuss more about it later, but just want to essentially say that I've had a lot of different types of experiences, and it's all valuable. And there's also things that I can aspire to as well.
Hi, this is Katie again, and my pronouns are still she, her. And I am now going to share a little bit more about my experience. Wow, it says that the breakout room is going to close in 52 seconds. So I'll try to talk really fast. I don't think that's possible. We might wind up jumping back in. But I guess, should I go ahead and advance to the next slide and we'll see what happens?
Yeah, Katie, I would say keep going.
Okay, so I came to this to be invited to consider presenting today because I am a member of what we call an inclusion network at Seattle Children's that supports people who have different identities or experiences that are in common that may present either challenges or, allow us or give us an opportunity to connect on things that may not be the typical. Parenting is really a big part of what brought me here today. And I think when I was younger, I didn't really consider how parenting would change my experience of working. But it has, so I'll share a little bit more about that, but I'll talk about these pictures. The first one, is one of me with, I have two children. My son in the picture was almost 2 and my daughter, or almost 3, and my daughter was almost 1, and I was graduating with my PhD with these 2 young kids. So that is possible. And now they're almost 14 and 12, and this is us out and about with our masks on during COVID. So next slide. In addition to parenting, one of the things that has really presented me with some different perspectives on my career path. And my daughter just yesterday agreed that I could share this as part of my experience and hers. When I was, I had just started a new job about 4 years ago, and my daughter was having a really hard time at school. She was a 2nd grader, and she was diagnosed on the autism spectrum. And I'm sorry, I tend to tear up, but it was really just the most amazing learning experience for me. And it was also, very surprising just how much more I I valued my job as a parent than I realized I would. And I wound up stepping down from my job at the time and taking a part-time job, and really it changed, my career path quite a bit. And I also started to reflect on my own experiences, and I wound up going in and getting diagnosed with ADHD. And our whole household has some aspects of neurodiversity. And my experience, looking back, my experience that relates to my neurodiversity was that I was told I was smart, but I struggled with writing, spelling, and organization. And really that's part of what led me to mathematics, because it felt more manageable to me a lot of the time. And even though I did well in the other subjects, it just came more naturally. So my favorite subjects were math. I loved reading as long as it was of interest to me. The boring things I had to work really hard to read, and still do, to be honest. In high school, I was a hospital volunteer, and that helped me to rule out nursing as a field. I had career discussions with my school counselor, my mom, and my sister. I considered possibly being a doctor, but my mom reminded me that my strong sense of smell could be a challenge, because I couldn't go into a fish store without gagging. So she was a little concerned about that. And again, I just chose a program that best fit my strengths, which at the time were mathematics, and kept options open. So I chose engineering instead of international business, which was my first choice, but my sister convinced me engineering would, keep my options open at the time. Next slide. Like Michelle, I set up a detailed, and not detailed, but a somewhat detailed path on this website, owntrail.com. And if you go to this, it's an open website, so you should be able to see the details of this path if you're interested after the presentation. But next slide. I walk through a few examples. I started my trail not at birth or very young, but when I first really started thinking about my career was after my dad died unexpectedly when I was 15. My mom, who had already suffered from anxiety and depression, was devastated and scared for her future, because she had been a stay-at-home mom. She hadn't graduated from college. She did have her high school degree, but it really, convinced me to go to college and to be financially independent, and to start really thinking about my career. Next slide. My first job, and I think as Michelle mentioned, the blue circles are the different jobs that I've had. So I've had many. My very first experience was a chemical engineering internship. And it was valuable, again, to rule out that and figure out that engineering was not really a good fit. And I had been planning to study abroad, and to work abroad as part of this program. And it was really difficult to make the decision to switch. But this experience really convinced me. I'll also mention that I was the only female in the department where I was working in my chemical engineering internship. And I experienced some, we didn't have the term microaggressions, but there were comments that were made that were related to my gender, and my, it gave me some perspective as well that I value in my interactions at work. But it was challenging. Next slide. After I won't go into details, but I wound up getting a mathematics degree and working for a few years afterwards, for 5 years. And then I went back to school after getting married and moving to Seattle. I started looking for some jobs, and I was like, wow, these jobs, there's a lot of healthcare industry jobs. And I wonder what I could do. And I found biostatistics through some research of jobs in the area. And wound up going back to school at the University of Washington. I got my master's degree, and it was tough at first because I had been out of school. My calculus was rusty, and I actually was failing my first class, and I had never been through that before, but figured out that I could study and do well and proceed. So That was a great experience. Next, as I mentioned, I had children while I was still in school. Next slide. And then I worked a few more different jobs and had the experience I mentioned about my daughter. And finally, 3 years ago, I found this great fit at Seattle Children's. Until very recently, I was working part-time, and I am a biostatistician. So I will go into what that entails after we cover just more broadly careers in research. So thanks.
Thanks, Katie, for that. So again, this is Michelle. So now we're going to get into the types of research jobs, and trying to be mindful of time. Hopefully we'll end around 3:50, so that way you still have at least 10 minutes for some questions. But please feel free to ask questions as we go through. So as you think about what some of your favorite subjects are, we have science, math, social studies, language arts, computer sciences, or some of the other classes. It's been a while since I've been in middle school and high school, so I don't know these days what subjects there are outside of the core ones. But when we think about all of these subjects, it turns out that actually all of them can be used and have been used in health research. And so now we kind of want to open it up to all of you to kind of maybe share what a favorite subject is, and it doesn't have to be necessarily on here. And from there, we'll share what some of those types of jobs are. And some things to keep in mind is that even though we have degrees that focus heavily on math, our day-to-day job is more than just using math. There's a lot of more skills that we use. And when, especially more entry level, when you start a new job, you're also learning a lot of new skills. So one, don't feel intimidated if you're entering a realm of unknown, because you also learn on the job. But also, it's great when you do have a broad spectrum of subjects that you're interested in or that you enjoy, because they do come into play across the board in different roles. So I don't know if anyone wants to share specifically any subjects that they do like. I share that I don't like English, but I do write a lot, as Katie will attest as well. So you can either type in the chat, and if we get no one, that's okay. We'll just proceed, and we'll maybe do, okay, so I see Sarah put human body system biomed. Oh, well, I think you, Sarah, I think you mentioned one that's kind of easy for us, which that's okay. I think actually that's the first one that goes up. So it's great one on the list. So Katie, if you kind of want to cover this for us.
Sure, yes. So, and to some extent, you might have self-selected this presentation, and even, I guess, the entire event based on an interest in science, or yeah, as you mentioned, the body system or biomed or biology. So some of the areas that you might commonly think of are doctors and nurses and pharmacists. And then all of those, in addition to caring for patients, can do research as well. And you may be either a faculty member or a research scientist. And basic scientist, we put that in quotes. It's really where you could get interested in a very specific field of science, and you may get a master's or a PhD, and then do research in a laboratory setting primarily. And there are also laboratory technicians and a lot of people who support the work in the laboratory who also have scientific interest and background. This is for mathematics. We already mentioned that Michelle and I are both biostatisticians. There are epidemiologists, data analysts, programmers, and grants managers or finance experts. May have a preference for mathematics or degrees in those fields. Okay. And Michelle, should I take this one as well and then hand it off to you? So social studies, some areas, and you might be surprised that someone with an interest in social studies would work in research, but some examples that we came up with that we thought would rely heavily on social studies are ethicists and review boards. So these are people who will make sure that what we're doing is protecting the patients and not breaking any laws. Regulatory affairs specialists would also consider the legal aspects, and if we're submitting to, for instance, the FDA for approval of something, they would help with that, and then or manage those details. And then the program managers coordinate across a lot of different professions to move projects along and to get us prepared to do studies, and also to keep things to make sure that we're following through with our plans when we conduct research. Okay, Michelle.
Yeah. So for language arts, again, we use it in different ways. One easy way is having interpreters. I'll kind of quickly go through these slides so we can kind of have more time for Q&A. There's, of course, computer science, which, again, as biostatisticians, we do a lot of programming. So it's actually nice to have some of those coding skills. And of course, there's so many more options in terms of careers and research. There's a department that's solely on facilities. And so if you see some of the really nice buildings that are downtown, that's essentially our facilities department. And then, of course, within the realm of Seattle Children's, we're working on becoming an anti-racist organization. And so there's a lot of work being put into that. And so all of these have different degrees, requirements. And so always kind of be open into what does it look like to be in research, because it doesn't necessarily mean that you have to have a degree in science or another STEM degree.
Oh, sorry. This is Katie again. I'll share some more about what we do as biostatisticians. And I can also mention before I share this that we work with the researcher, the faculty or research scientists to conduct studies. So I know that someone mentioned they don't really like math. And one of the beautiful things about having a biostatistician on your study is that you don't have to like math. You can really explain what the question is, and we can help you answer it with statistics. So we help design the studies. As Michelle mentioned, we do a lot of programming as well. Sometimes we have programmers who work with us, and then we present our results to an audience. Sometimes this requires some skill with translating the results from statistical jargon into common language. And then again, we collaborate with a lot of different people, which is part of what I enjoy. Next slide. Yeah, so we were initially going to cover opportunities to explore. For the sake of time, though, we do want to open it up to Q&A. So at this point, I will get out of screen sharing. And if there are topics specifically that anyone's interested in, I can pull up the slides again. And I will kind of add that in terms of what I love about my job, I love talking to people. And so that's something that I've really learned to enjoy. I'm all about the people. So if you guys have questions, you can type in the chat or unmute and ask directly.
Sarah, I was going to say, if you interested in human body systems but not math, maybe you might be the person who wants to come up with the good questions that we want to investigate, and Michelle and Katie can help you figure out the study that'll get to the right answer. Does anybody have any questions, any terms? There were a lot of terms. We had a lot of healthcare and research are very heavy with lots of words that you don't necessarily hear every day. So if there's anything you have a question about because you didn't understand, or other questions, Vicki has a question. Are biomed chemists also based on research?
I think my sense is that you may do research, or you may do some applied work where you might work in, as a biochemist or biomed chemist, and in a lab where you're assessing whether someone has a disease. I actually don't know a whole lot of biomed chemistry, but my guess would be that there would be an applied role as well as a research role. And the research side would be, again, answering questions that either may allow you to create new assays or tests, or to understand mechanisms for the way, and mechanism is another jargon type word, but it's just, how do things work in the body?
Yeah, and Sarah asks, what study would you consider for a person who struggles with math but adores medical terminology and anatomy?
Michelle, you want to take that one?
I can. Well, I would say, as someone who struggled a lot with English, I'm sure in some ways it's similar in that I learned how to get people to review my work. So I asked for a lot of help as well. In terms of what to study, I mean, to me, it seems like pre-med would probably be a good fit, like an undergrad. I realized that I did not like all the medical terminology. So it seems like Sarah and I are just like compatible in terms of what we like or dislike, because I'm actually the other end, that I excelled in math, but had a hard time memorizing. And what I've learned is that I still have to memorize. I still have to write a lot, and I don't like it, but I give myself more time. So on exams, I would give myself more time. I would ask for a lot more help. And so whatever it is that you do study, that, you're still going to have to take math courses, because that is, I think, a requirement even for graduate school as well, or med school. I actually don't know since I'm not in that, but I know at least in undergrad, you would have to. So just make sure that you're getting the right support if you do pre-med.
Well,
go ahead.
I was going to say one thing. I think Michelle and I each mentioned that we changed majors in college. So you can start in one, path and switch. Just, I would say, something with pre-med, if that's your interest. And then you can kind of navigate within that based on what appeals to you when you take
your. And I was going to add, if medical terminology and anatomy are of interest to you, there are so many different ways that you could go, both in terms of pre-med or undergrad, or directly into a 2-year or 4-year college that is focused on a specific discipline, right? So you could say, I really love the way the human body works, and I would like to do physical therapy or be a physical therapist assistant, right? And I think the most important thing is to lean into those things that you feel curious and excited about. And build around that. And if math is something that you have to conquer to get to your dream job, you'll probably find some way. And even I think earlier in sessions in this week, we had a physician, a doctor, who said, I have to do math in my job every day, but it's not calculus, it's addition and subtraction and multiplication and division. And so when there are things that I struggle with, like, there are resources to help me bolster those skills. And so I have to do it. And I had to, figure that out, because it was a vehicle for doing what I really love and what I feel passionate about. So I think it's, it seems like you have some clear ideas of things that you're excited about, and definitely lean into those and explore those. And I think doors will open that you may not even have known existed. And check out the scavenger hunt, because there's lots of different jobs that I think on that have a connection to medical terminology, and in some cases anatomy too. Other questions or things you'd like to understand more? Advice for any future OBGYN?
I would say talk to an OBGYN. So, really, what courses, finding a pre-med program that has some courses that are taught by OBGYN, so you can look at the faculty profiles as well. I don't know, Shauna, do you have?
Yeah, and if you're still in high school and you have, I mean, certainly science and math classes will help you a lot, because for an OBGYN, your starting point would be pre-med and medical school, and then with a specialty in obstetrics and gynecology. And so any of that math and science that you can take now will strengthen your just your readiness for those things. I would say too, like if you have a chance in high school or through career and technical education or through Running Start to take like anatomy and physiology classes, I think those would be really helpful, and learning, more about just learning more about the human body. And as Katie said, I think, yeah, talking to people who are doing that work and understanding what advice would they give themselves looking back, knowing what they know now. And Wendy has a question for both of you. What kinds of research projects do you both get to analyze data for?
So I can quickly answer that. So actually one of the studies that I helped with was looking at IV antibiotics. So for those who have gotten an infection, and again, I don't even want to go into what it is, because again, I'm I'm a statistician, so I don't remember. But I just remember, for example, that my daughter, who is 2.5 weeks, she had to get IV antibiotics. And during that time, I was on a study that was actually looking at the length of IV antibiotic duration. And I felt like I finally got it, of like, this is why it's important. And I actually, and while what she had was very different from the population that we were analyzing for, since we work with NCF research, what was cool was that I finally was able to kind of see like, physicians will actually look at the research and the articles to get a better understanding of how long should a patient be treated with IV antibiotics. So that way they don't stay in the hospital for so long. And I remember seeing a physician referencing an article that they had read about that. And so it was kind of, for me, I loved it, because then I was able to go back to the PIs and the doctors and be like, I get why you designed this study. I get it now. And so it was nice to be able to help analyze that data and to get a better understanding of, how long they were to be on IV antibiotics.
Yeah, that's great. Thank you, guys. I think we're going to get pulled out of this session pretty quick here. And so I just wanted to finish by saying that if there are things that about this session or just this week that leave you curious to find out more, we didn't have enough time to go through all the slides, but we will be sharing this presentation, and there are some links included in the presentation that are to programs that, whether it's a summer program or it's just a brief internship opportunity or volunteering, that there are lots and lots of ways that you can get involved and find out more. And I think one of the things that you could see in these presentations today is that both Katie and Michelle shared their pathway was kind of more like this than a straight line, right? And that's kind of how we find our place. And both shared that they changed their majors, right? And so I think the more that you can experience things and learn about things you're curious about, the more that you will find your own path. And so if you find yourself curious after this week, please check out some of the links that are in the presentation today and some of the links that are in the scavenger hunt as well, and look for opportunities just to meet people and talk to people and make notes about what you find interesting and Google things and do your research, because I think you will find lots of good opportunities and resources out there. Any final words, Katie or Michelle, parting words?
I guess I can just say, find something that you love to do, and really be flexible and go with your intuition. I think when I've gone with my intuition, I've had better outcomes than when I tried to stick with something that I thought was an expectation from someone else. So.
Yeah, absolutely. I echo what Katie does. I'm a big person sticking with my gut. So I think your gut definitely is the way to go, at least from my perspective. And of course, just having that open curiosity in whatever it is that you do and being okay with like, hey, I thought I loved this and then I experienced it. Turns out I don't. And that's okay. And that I think that's part of the learning and growing and figuring out what you actually want to do. So yeah. And be okay with failing because that happens. I failed plenty of times.